So many times when we do plastic surgery, especially the more extensive plastic surgery where we're taking a lot of tissue off, or there's a big abdominoplasty, or whether we're doing a lot of liposuction, it is imperative that the patient understands that you got to try to maintain an ideal weight. Now, some weight changes, 5 to 10 pounds here and there is not a big deal. But greater weight changes can really affect the results. It's sort of like getting fitted for a dress and now putting on a weight and it won't fit you anymore. The problem is that in our body, this other phenomenon happens, which we call paradoxical lipodystrophy, where it means that now, because your body's normal fat stores have been taken out, like normally, most people have a tendency to store fat in their lower abdomen, in their love handle area, and the rolls in the back. If we've already done liposuction in those areas, or if we've cut out the fat and skin here, we have now taken out where you could have normally stored fat if you were to gain weight. So when you don't have those sources, you're going to try to gain weight elsewhere that you normally wouldn't store fat. Those elsewhere could be in your arms, could be in your buttock, could be most commonly inside of your abdomen in what we call visceral fat, which is the fat that is around your intestine and around your stomach. That fat is almost like a blanket that is technically supposed to protect those organs, but in light of you not having the other typical casual suspects for storing fat, what's going to happen is that that fat can become bigger. You may have seen people who look like they have a six-pack or really have a tight belly, but they look like they're a few months pregnant. So those are people who have visceral obesity and potentially may have had developed it because they've gone prior liposuction and then now, for example, gained 30 to 40 pounds. Those are some of the things that happens. The good news is that if those people try to attempt to lose some weight, that fat is extremely responsive to weight loss, unlike some of the other fat in our body, and it will go down and they can restore and regain what they had before.